What causes chronic myeloid leukemia treatment to lose its effect? Imagine starting a treatment that seems to be working well, only for it to suddenly become less effective over time. That's a common challenge in managing chronic myeloid leukemia, a type of blood cancer characterized by the presence of the BCR-ABL1 fusion gene. This gene produces an abnormal protein that causes leukemia cells to grow uncontrollably. The main treatment used is tyrosine kinase inhibitors, which block this protein and help control the disease. But sometimes, these drugs stop working as well as they did initially. So, what causes this loss of effectiveness? One of the most common reasons is mutations in the BCR-ABL1 gene itself. These mutations change the structure of the abnormal protein, making it harder for the drugs to bind and inhibit its activity. The T315I mutation is a well-known example that can cause resistance, leading to treatment failure. When the leukemia cells develop these mutations, they can continue to grow despite ongoing therapy. Resistance can also develop through mechanisms that do not involve changes in the BCR-ABL1 gene. For instance, the leukemia cells might activate alternative signaling pathways or acquire changes in other genes that help them survive even when the primary target is blocked. These changes can make the cells less dependent on the BCR-ABL1 protein and allow them to bypass the effects of the drugs. Another important factor is the presence of leukemic stem cells. These are a small subset of cells that can remain dormant and are less sensitive to tyrosine kinase inhibitors. Even if most of the leukemia responds to treatment, these stem cells can survive and cause the disease to relapse later on. During treatment, additional chromosomal abnormalities may also develop. Besides the Philadelphia chromosome, which is characteristic of CML, other genetic changes can occur that promote resistance and disease progression. These additional abnormalities can make the leukemia more aggressive and harder to control. Patient-related factors play a role too. Poor adherence to medication schedules, drug interactions that lower drug levels, or issues with absorption and metabolism can reduce the amount of medication available in the body. When drug levels are too low, the leukemia cells may not be fully suppressed, allowing resistant cells to survive and multiply. Sometimes, side effects from treatment lead to dose reductions or stopping the medication altogether. This can compromise the effectiveness of therapy and give resistant cells an opportunity to expand. Monitoring treatment response is crucial. Doctors measure the amount of BCR-ABL1 gene transcripts in blood or bone marrow. If these levels do not decrease as expected or start to rise after an initial decline, it indicates resistance. Recognizing this early helps clinicians adjust treatment strategies. When resistance occurs, options include switching to a different tyrosine kinase inhibitor that can target specific mutations, combining therapies to attack multiple pathways, or in some cases, considering stem cell transplantation. The goal is to find the most effective approach tailored to each patient's specific situation. In summary, treatment for chronic myeloid leukemia can lose its effectiveness mainly because of genetic mutations in the BCR-ABL1 gene and other cellular changes that let leukemia cells evade drug effects. External factors like medication, adherence, and drug levels also matter. Ongoing monitoring and personalized treatment adjustments are essential to keep the disease under control and improve outcomes. Always consult healthcare professionals for guidance tailored to individual cases, as leukemia management is complex and varies from person to person.